Over 180,000 women in the U.S. are diagnosed with breast cancer every year. Many choose breast reconstruction to restore a more natural appearance after one or both breasts have been removed with a mastectomy. Breast reconstruction may be done at the same time as your mastectomy or at a later time, depending on your cancer treatment and personal preference. A variety of breast reconstruction options are available after mastectomy. Thanks to the Women's Health and Cancer Rights Act of 1998, most insurance plans are required by law to cover breast reconstruction. If your insurance plan covers the mastectomy, your plan probably also covers breast reconstruction and any surgery to attain symmetry on the remaining breast. Your surgeon who removes the breast cancer and your plastic surgeon who reconstructs your breasts can help you decide which options are best for you. An overview of breast anatomy will help you understand the reconstruction process. Your breast consists primarily of fatty and glandular tissues, which determine the size and shape. Firmness and lift are generally influenced by how well ligaments connected to the chest wall support your breasts. The fatty tissue and ligaments surround the milk-producing glandular tissue and milk ducts. Breasts also contain nourishing blood vessels and lymph vessels that help the body fight off infection. There are tiny muscle fibers in the nipples, but otherwise the breasts are non-muscular. However, they lie atop two layers of muscles, the pectoralis major and pectoralis minor, which separate the breast from the chest wall. Often during a mastectomy, all glandular tissue, fatty tissue, ligaments, and lymphatic tissues are removed. Additionally, the nipple and areola may be removed to avoid the risk of recurring cancer. Occasionally, some of this natural tissue is spared with a nipple-sparing mastectomy or tissue-sparing mastectomy. Options for breast reconstruction include tissue-based or implant-based reconstruction. Tissue-based breast reconstruction involves moving tissue flaps from your abdomen, upper back, hip, or buttocks to reshape the missing breast. Tissue-based reconstruction options include the tram or deep flap, which involves moving skin, fat, and muscle tissue from the abdomen to the chest. The latissimus dorsi flap, which involves moving muscle, skin, and fat from the upper back to the chest, and typically requires the addition of an implant. And the gap flap, which involves moving sections of skin and fat, but no muscle, from the hip or buttocks and repositioning them in the breast area. Implant-based breast reconstruction is the most common form of breast reconstruction and is usually performed in two separate stages, which are described next. Following a mastectomy, your chest tissue may be flat and tight, and your skin may need to be stretched to make room for a breast implant. Breast reconstruction with implants is a two-stage procedure that involves expanding the tissues and then placing the implant. During stage 1, a tissue expander, which is a silicone shell with a fill port, is inserted under your skin and pectoralis major muscle at the site of your mastectomy. Over a period of several weeks, your physician will use a tiny needle to inject small quantities of sterile saline solution into the expander through the fill port. The skin will grow and stretch over time as the expander is filled. Once your chest tissue has expanded enough for your breast implant, the second stage of the reconstruction will be performed with the placement of implants. During the second stage of your breast reconstruction, your surgeon will deflate and remove the tissue expander and insert a saline or silicone gel-filled implant into the breast pocket. The feel of your breast implants are most affected by the material inside. Saline-filled implants have an elastic silicone rubber shell and a feel quite unique to being filled with water. Gel-filled implants have an elastic silicone rubber shell filled with cohesive silicone gel and a feel more like that of breast tissue. Saline implants are empty when placed in the newly formed breast pocket and then filled with saline fluid to the predetermined size. Silicone gel implants are pre-filled when placed in the breast pocket. This stage of the reconstruction procedure typically takes 1 to 2 hours and usually does not require a hospital stay. The current generation of breast implants, either saline-filled or silicone gel-filled breast implants, are all FDA-approved, tested, durable options. Both saline and silicone implants come with either smooth or textured surfaces, an option that you may discuss with your surgeon. Your surgeon will likely prescribe medication to manage your discomfort, and you may need to wear a compression garment to minimize swelling and help maintain the position of the implant. Any dressings, surgical drains, and non-dissolving sutures are typically removed within about a week. Some tenderness, swelling, and discoloration are typical and will eventually fade. Be sure to follow your surgeon's recovery plan to avoid any complications. It is important to note that almost all breast reconstructions require one or more secondary revision procedures to create a more natural or balanced appearance to the breasts. Secondary revisions may include optional procedures such as reshaping or resizing the opposite breast or the reconstructed breast, adjusting the position of the breast crease, or reconstructing a nipple and areola. Some of these procedures can be done at the time of the mastectomy or during the implant exchange procedure 2 to 3 months after the initial reconstruction and after any cancer treatments are completed. After a mastectomy, your breast can often be restored to near normal shape, appearance, and size, and scars from the incisions will fade considerably over time. Most women have a renewed body image and improved sense of femininity after breast reconstruction with tissue expanders and breast implants. The Natrelle 2-stage reconstruction system is a collection of tissue expanders and breast implants that offers many options to satisfy your personal needs during breast reconstruction. Visit Natrelle.com to learn more about your breast reconstruction options or to find a plastic surgeon to add to your complete recovery team.